So do you think that the patients in general and PTs, do they know about the role of the PT in this process? Like, do you think that they look as much as they should? So what do you think is missing there? And how do you think we can change this?
That's a good question, because I've asked the patients that have found me, and a lot of mine, because I am at a network, it's word of mouth. It's so-and-so said you're decent, so I wanted to come check it out, or you're good, or you know what I mean? You help so-and-so. I think it's just getting the word out and allowing people to know what the heck we actually do. You don't have to see us if you have an ankle sprain or a back pain. Like, think of us as wellness providers as well, because if, like we said, if you can go into pregnancy and postpartum with a tool bag of exercises and movement patterns and things to watch for, in the long run, we do better. And one of my big, I guess, pet peeves or passions is if I can address the little issues now in our 20s and 30s, when we're our parents' age, 50s, 60s, 70s, we can avoid so many other compensation patterns and habitual changes that just, your body is smart and it finds the least, the path of least resistance. If we can give your body the appropriate movement patterns and the appropriate just stimulus now, and then teaching those muscles to turn back on and rewiring that mind-body connection, there's so much we can avoid down the road. So I don't know how to, I think it's talking, and I've been on a couple other podcasts. It's talking at moms groups, it's talking to friends at church. It's like being real and saying, look, when I squat, I pee, or I can't bend over and touch my toes without passing gas on myself, or, and that's just the postpartum. There's endometriosis, and there's bowel issues. There's so much that we can help address that doctors don't have the time for. They don't know the musculoskeletal system the same way we do. So maybe it's communicating with the doctors in that medical field as well, and getting them to understand what we do to be, I don't know, we're all passionate. We all have histories in the women's health world. And once you come see us and get comfortable, we'll tell you our own stories. But I don't know. The Instagram posts and this, and just being real about the junk that we go through as moms.
Yeah. I think it's interesting because on the podcast, every time we talk about pelvic health, it has a lot of people coming and commenting and say like, oh, thank you for talking about it, because it's not like a topic that a lot of people talk. So every now and then I like to bring someone that talks about the topic because I think it's important. And then I have friends reaching out to me because they know I am a PT, and they ask about like, oh, I need someone to help my sister that got pregnant. Do you have anyone to recommend? So I think that's nice, but I don't think it's the average population. So I think as much as we talk to our friends, and I know that you have a very active Instagram. I follow you, so your posts are very nice and informative. So I think it's just trying to share this information. So that's another goal of the podcast. And then I share with my friends, and I was like, I had my group. I had 3 or 4 friends that got pregnant last year, had the baby, and they call me, oh my God, I can't, like exactly as you said, like every time I bend forward, like my back, my lower back's killing me. What do I do? So, and I think that's very normal. We just don't talk much about it. And when you start talking to our like close group of friends and women that go through that, you see like how it is really real, and everybody passed through the same struggles.